My name is Richard Hixson, Consultant in Critical Care and Vice Chair of our Sustainability Development Group. I hold sustainability-related positions regionally and nationally, work directly with NHS England on reducing the environmental impact of our supply chains, and I'm a co-founder of NHS Ocean. It should no longer be a surprise to hear the Earth is warming faster than ever observed, and carbon dioxide from our use of fossil fuel is the main causative agent. This is the most pressing emergency humanity has ever faced, with CO2-driven ocean acidification now occurring faster than during previous mass extinction events. Species are disappearing 100 to 1,000 times expected, with the resultant critical loss of biodiversity. Failure to tackle the climate crisis will lead to a complete loss of Arctic sea ice, endangered global food supplies, mass migration and death on an unimaginable scale, all within the lifespan of children born today. The NHS Chief Executive, Sir Simon Stevens, described the climate emergency as a health emergency, and the NHS, the biggest employer in the country, is both part of the problem and part of the solution. The NHS is responsible for approximately 5% of UK emissions, with carbon dioxide, nitrous oxide, anaesthetic agents and inhaler propellants all contributing. Each year, the NHS uses a similar volume of water to the whole country of Estonia and produces over 500,000 tonnes of waste, which is a challenge to dispose of sustainably. Pre-COVID, the NHS was responsible for 13% of all UK road travel, which amounted to almost 10 billion miles per year. Healthcare is, however, in an odd position, as we are also required to treat the health impacts of our own emissions, such as that associated with air pollution. And the more unsustainable care we provide, the more we fuel the climate crisis. And whilst there are massive global political and economic challenges ahead, there is a growing need for decisive national and local actions. In October 2020, NHS England published Delivering a Net Zero National Health Service, and I would urge you all to read this document as it sets out the NHS vision to become the world's first net zero healthcare provider. This call to action sets clear targets: net zero by 2040 for emissions we control directly, and 2045 for those we can influence, including from our supply chains. Net zero calls for providers to produce a green plan approved by their governing body, along with an annual summary of their progress toward net zero. It is therefore with great pleasure I can now present our first Green Plan, Sustainability Matters. Developed by a multidisciplinary group led by Sue Jakes, Sam Wheeler and myself, it sets out CDDFT's vision of providing the safest, most compassionate healthcare, whilst taking all reasonable steps to minimise our adverse impact on the environment, society and the planet, thereby not compromising the health and well-being of future generations. The plan describes some of the amazing progress that has already occurred and shows a glimpse of what is possible. It recognises the challenges related to engagement, finance and offsetting residuals, but just like delivering a net zero national health service, this plan will evolve and adapt as we learn and wider advances are made. Aligning to net zero, CDDFT aims to be carbon neutral by 2045, and our plan sets out the first important steps in that journey, a journey that requires us to combine our efforts. We all have a role to play, and I invite you to join us and support in delivering our short-term goals and to challenge us to go further in the years ahead. The plan is publicly available on the Trust website. It is one element of a whole programme comprising 8 key areas, each of which has an identified lead who can be approached to receive ideas and support those who wish to become green champions. It is important to note, however, these key area leads require individuals and groups to deliver change, and success depends on everyone pulling together. There is evidence that investing in a green plan can reduce costs and improve quality, and I would ask you all to keep this in mind as these proposals will take place alongside the development of accounting that quantifies not just financial but societal and environmental costs too. Sustainability impact assessments will be incorporated into business cases, and one thing is clear: the planet and NHS cannot afford the cost of business as usual. One common question is, how can I get involved and make a difference? so we've provided some ideas within the plan, which I can now also summarise. Firstly, read the Green Plan, and if you have any questions, comments or suggestions, then contact your key area lead to discuss. Become a Green Champion, as we are launching a social media network for ongoing engagement and to make it easy to submit ideas and join the conversation. Take advantage of any learning related to sustainability and planetary health. HENI are currently developing an educational package which will be made available to everyone across the region. Avoid fossil fuel powered travel whenever possible. Walk, cycle, use public transport, video conference and car share when safe to do so. Avoid travelling long distances for professional development. Look at what can be achieved virtually, and when face-to-face education is necessary, try and stay local. Engage with simple but proven energy-saving initiatives like operational TLC, turn off equipment, lights out, control temperatures. Always turn off taps and report leaks promptly so the trust can respond and repair. Eat less meat and use less dairy, both at home and if you use the hospital canteens. Reduce waste by asking, do I need to use this? Can I reuse afterwards? And if not, how do I recycle? Challenge the single-use philosophy we have all become so accustomed to. And spread the word. Talk about what you and we are doing and encourage others to adopt good practice. It is important to recognise there are many who feel this is hopeless and the world will not change. And as a result, there is an increase in eco-anxiety, especially in younger generations. I do believe, like many others, however, there is still time to change trajectory, but we only have a small window of opportunity left. There is truth in the often quoted, we are all in this together, as we have all helped drive climate change at some point in our lives, and it is together we can generate the required mass effect to reverse these impacts. Thank you for listening, and if you have any questions, comments or ideas, please contact either your key area lead, myself, Sue Jakes or Sam Wheeler. Contact details for us all are in the Green Plan.